No, you don't need that. Yeah. Okay, thank you all for coming. Let me begin by introducing our speaker today, and I appreciate all of those who have been tracking us around campus as we change the venue for our seminar series. But this is a very good room, and we will make sure that you get enough time to respond to those announcements. And we also always publish contact information for those who need additional guidance on our next series and where we'll hold them. Our website also has all of the seminars that we've hosted this year, and luckily we have them recorded, and if you miss any particular seminar, you can go to OpenCourseware through the university extension, and everything is captured, including my introductions, I suppose. So we have 3 more this quarter, exciting seminars, so please look forward to those announcements. It's a particular pleasure for me today to introduce Dr. Eric Walsh. Okay. Please come in. Let me see. It's a distinct pleasure for me to introduce Dr. Eric Walsh. I heard of him almost 2 years ago now, and luckily for me, he contacted and said, what's going on with the public health program at UC Irvine? He's collaborated with many colleagues here on campus, and we had a great meeting and shared a lot of information and mutual interests. His MD and PhD, he got his MD degree from Florida, but he's accomplished a lot since, and he's traveled all over the world doing medical practice. And currently, he holds 2 very challenging positions in the Orange County Healthcare Agency. He's the Interim Director for the Correctional Medical Services, and he continues to support the Family Health Services as the Medical Director for the County of Orange Healthcare County Family Health Services. Nationally, he's on the Presidential Advisory Committee for HIV/AIDS, and this, of course, involves a lot of international activities and advice to the President. He was also an advisory committee for the Surgeon General David Satcher, who is currently at the Morehouse School of Medicine. He is currently helping us with our NIH-funded Global Health Framework here at Irvine, and many of our students are benefiting from his wisdom, and we thank you for doing that for us. So today he's going to talk to us about what keeps him busy the most, I hope, stress and health disparities.
Thank you. All right, we'll get right into it. I'm hoping that I don't become a victim of my own talk in some sense with all that I do. But we're going to talk about stress and health disparities, and hopefully give you a framework, a new framework for how it is that America has the best medical system in the world, the most resources of any nation in the world. I still believe a nation with the greatest opportunities in the world, and yet we have these staggering health disparities, and we'll show you some of that today and how that might be possible. So we'll start with a case study. This is how we do grand rounds in medicine. So we'll start with a little case study to show you an example of this. This is a 7-year-old African-American boy. You can see his picture in the far left there. He has repetitive visits to the emergency department with asthma exacerbation. He's on albuterol inhaler, PRN. Many of you know about albuterol if you ever did summer camp. Some kid was on inhalers, and if you didn't have them when you played softball or dodgeball, he'd go into a fit. He's on an Advil discus twice daily, and has needed steroids for treatment many times. And this could be prednisones, or going to the hospital, he has to get salumedrol injections. He's been hospitalized 3 times secondary to uncontrollable asthma exacerbations. And as a physician, if you have a patient with asthma, it's one of the most important questions to really ask to find out how controlled their asthma actually is. How many times you've been hospitalized. And really I should have put here 3 times in the last 2 years. Over what period of time is pretty important. So we don't want to just look at the child, let's look at the mother as well. The mother is also very important. The single mother with 3 children, works for minimum wage, the biological father is absent, neighborhood with high crime rate, high violence, living conditions with high environmental pollutants, poor social support network, feelings of hopelessness, and feelings of lack of control. Some of these all of us can probably relate to. But the one that really is the staggering overall arch is being a single mother with 3 kids without the support of a partner of any kind. So this is a stress life of the mother. Well, just to really drive a point home about asthma, you can see that asthma actually from a pathophysiological standpoint is quite an interesting disease. It has 3 components, and I always explain this to patients because if they understand the disease, it often helps them to manage it better. Asthma is a perfect example of a very intricately involved medical condition, but has strong public health foundation. And the good physician is going to make sure that they blend the public health with the medical treatment because they go together so well. The normal bronchiole is wide open. You can see big open channels here. There's no inflammation along the lining. The muscles around the bronchiole is relaxed, and there's no mucus plugging the bronchiole. And the 3 components of asthma, of course, are constriction. That's what the albuterol inhaler is for. And you open it up. It's inflammation, which is what happens right here. This gets all inflamed. There's damage to the lining of the bronchiole, which inhibits gas exchanges. And there's also mucus plugging, which is what this yellow stuff is here. Mucus plugging. And the mucus plugging often is what, bam, a piece of mucus blocks off enough of the bronchioles, and you can trigger asthma exacerbation or an asthma attack. So when we treat it with albuterol inhaler, prednisone tapering course if they can go home, and I always tell them to take Mucinex, breaks the mucus up. One of the things that a lot of people don't think about is how does diet affect this? Diet affects this greatly. We do know that if they eat taking a lot of dairy, cheese, things like that, it actually increases mucus production and can predispose them further. If they eat foods that are simpler, refined carbohydrates, it will be pro-inflammatory, increase blood sugar, lower the immune response, and they'll actually have more problems. So how much access does this kid have to fruits, vegetables, whole grain foods? How clean is the air they breathe? How stressful is the environment? You're going to find all of these things make a difference in asthma. So it is not just, you can't just treat that patient. If you do that, you'll be throwing a lot of medicine at a little baby or a young child, and you won't necessarily get to the core root of the problem. So what I want to do now is go through a few of the Centers for Disease Control slides from 2002 from their National Health Interview Survey. We were just talking about, I think someone just mentioned that to me. And so let's look at the statistics here. They're pretty interesting. If you look at this, more females than males have a prevalence of lifetime asthma. More Puerto Ricans than most other Hispanic groups and most ethnic groups, 196 per thousand population. Total Hispanic is 83. Native Americans, 133. Non-Hispanic blacks, 138. Non-Hispanic whites, 111. If you notice here, everybody but Puerto Ricans, it actually balances out, looks a bit balanced. Asthma attack prevalence, Puerto Ricans still beat. And this goes back to a lot of environmental factors and stressors. We don't often, one of the problems we have when we deal with Hispanics in the United States is we lump Hispanics together. It's almost one of the most, from a statistical, ethnical, sociological standpoint, one of the most wrong things you can possibly do. I'm technically part Hispanic. My stepfather is from the Dominican Republic, so I guess not by blood, but by love. And so I've been to the Dominican. Dominicans are very different than Puerto Ricans, are very different from Cubans, are incredibly different from Mexican Americans or Argentinians. So when you lump them all together, it would be like saying everybody from Alabama is like everybody from Washington State, except even a bigger difference than that. So that's one of the problems. You see it when you break out the data like this. And you can see age differences and so forth. Look at asthma outpatient visits. Blacks and whites are almost the same here. Females more than males. A lot of times we really give this a disease of young boys. And in fact, you'll see that it's gender, it leans towards young girls. But let's look at what happens to the disparity in health outcomes and health practice once you start looking at specifically bad outcomes or more high energy outcomes, more acute outcomes. Asthma emergency department visits, look at the difference between blacks and whites. Look at the staggering difference between how many visits per 10,000 population you would get in 2002 compared to whites with asthma. Staggering difference, and the female-male balance is out. The younger you are, 17 and under, that makes sense, but that staggering difference of a disparity in that outcome between blacks and whites, that shouldn't happen. They've been equal. Every other slide, they were just about the same. All of a sudden, bam, blacks jump way out. Well, let's look at another one. Look at hospitalizations. What did I say? That's one of the most important things to ask if you're trying to gauge how severe the asthma is. And when you do that, look at what happens. 3 times per 10,000, 3 times the rate for blacks of asthma hospitalizations. Very, very serious difference there. And most important in all medical research, public health research, is mortality. We forget that. And the pharmaceutical companies dupe a lot of people into a lot of fancy, expensive drugs that actually never affect mortality. They don't change anybody's death outcomes. They may change your blood pressure, they may change your cholesterol level, but they don't actually stop you from dying when you were going to die anyway. So we spend all that money on drugs, and this is the quintessential, most important slide in essence, because it shows you that per 100,000 the deaths are more than 3 times higher for non-Hispanic blacks than for non-Hispanic whites, or even for Hispanics. Huge difference. This is a health disparity. This is not diabetes, it's not heart disease. These are children who theoretically should have a better start at life than to have these kind of odds stacked against them if they're asthmatic. So you start looking at the literature and looking at some of the data, and prenatal stress and impaired immunity in infant, Dr. Rosalind Wright of Harvard University did a study, and she showed that if the mother had stress while pregnant, this is critical, if the mother had stress while pregnant, what they did is they actually took cord blood, kind of reminded me of the National Children's Study. They took cord blood and they actually looked at how well do the immune cells respond when challenged when the cord blood is drawn. And they found that if the mother reported, and they did extensive questionnaires when she was pregnant, if the mother reported higher stress levels during pregnancy, the child's immune system didn't work as well based on cord blood, and they're following these children to 18 years of age. There are a lot of people who say, it's not a big deal. I tend to believe that there's something probably there, and Dr. Patik Wadwa here of UCI would probably back that up with some of the great research that he's done, and his team has done here. So when you look at that, that's one thing. So if you're stressed before the baby's even born, it begins to tell. So interesting is the study that they even make reference to the idea that it's generational, that the grandmother's stress can actually affect the asthma outcomes of the grandchild. The grandmother's stress during pregnancy and stress in her life. There's a very interesting text in the Bible that says that God would visit the sins of the generation to the 3rd and the 4th generation. My mother would always tell me that when I act bad. So it's interesting that from a public health standpoint, you almost get to see that. How one person affects generations going down.
Is that when the grandmother lives in the house?
No, that's just in general. Just in general, when they ask questions about the grandmother.
Do they think it's a genetic?
No, they don't think it's genetic, because when you look at it, there are other people, there are other ethnic groups, and I'm gonna get to that in a second, that actually live in just as poor neighborhoods in New York or Chicago, and and everything else is pretty much the same. They have better outcomes. And when you look at it, if it was purely genetic and the kids all have asthma from whatever ethnic group, you would assume that you'd be able to trace genetically back the same way, and you can't. It doesn't genetically trace backwards. It's not genetic. They're genetic predispositions. But we know from the research also that if you change certain things, the rate of asthma actually goes down as well. Oops, wait. I was supposed to talk about the bottom part. Oh, violent neighborhoods and caregiver stress are predictive of asthma severity. Dr. Gupta of the Children's Morehouse School of Chicago, Illinois, did a study which was pretty profound and showed a strong statistically significant connection between two things: the caregiver stress of the asthmatic child. Who's the caregiver of the child in the case study? The mother. Her stress levels, even after the baby's born, are also predictive of how severe the child's asthma is going to be. So that single mother with 3 kids, working 2 jobs, trying to make ends meet, doing whatever she has to do, hustling to make $1, Try to make $1 out of 15 cents, as they say. Her stress also will predict what that child looks like, even after the child is born and they're growing up. The other thing that's interesting is the violence in the neighborhood, actual violent acts. So in this study, they actually looked at the police records and mapped them and overlaid them with asthma. And when you do that, the more violent the neighborhood, the worse the asthma. Now, there's a lot of ways you could try and explain that. It could be purely stress related, but it can also be that if the neighborhood's more violent, you keep the child where? Inside, so they get less fresh air. It could be that you are less likely to go to doctor's appointments. It could be that you're less likely to go get an inhaler from the drugstore when you need to if it's dark and you ran out. So, but these things are predictive of more severe asthma. Those studies will continue as well. So let's look at some of the things that they say about within the first 48 hours of a stressful life event, there's almost 5 times the likelihood of a new asthma attack. And the reported effect increases the risk of 4.69. The risk subsidized within 3 to 10 days, but flares up again 5 to 7 weeks after the event, this time to almost double the risk. Dr. Jarvenpa, this is a study that was on asthma exacerbation in children immediately following stressful life events. So we know that acute stressful events will definitely trigger asthma. This is one of the things I saw when I was a resident doing my, or medical student, actually doing my pediatrics rotation at the University of Miami in Florida, that you saw that there would be sometimes a breakup in the family, divorce, some other stressful event, domestic violence happened in the home, and the child would have an asthma attack, and we would see the child in the hospital. So we know that stress works this way and can contribute to that big disparity that we saw in the earlier slide in mortality, ER visits, and other things. So stress can be part of what's doing that. But I want to show you that there's stressors that lean more in favor of one group of people over the other before we get to probably getting beyond even this kind of data. And this is from this is 2005 preliminary data from I think from the Bureau of Statistics. Percentage of all births born where it is by race, unmarried women. And if you look at this line and you follow the graphs, the green line is non-Hispanic black. Look at the percentage of all births that were to unmarried women by race. These are staggering statistics. This is the federal government data. Staggering statistics. How stressful is it? 70% of the births are born to unmarried women. I mean, to be honest with you, compared to the standards of 200 years ago, all categories aren't doing so good. But when you look at it, 70% is a staggering statistic. And if you add up all that we know about being a single mother, not having a biological father, being in poor neighborhoods, and then we're going to throw in discrimination and other perceived things, the stress levels are probably pretty astronomical in that group of people. So how do we explain this? And we go to a new concept, well, a relatively new concept. Bruce McEwen is the researcher who is most responsible for this. Sterling and Irons reported this in 1988. Allostasis is a relatively new concept. When I was studying biology in college, it was only homeostasis. So allostasis has come along, and it is the process by which the body maintains stability or homeostasis during adaptation to environmental and physiological events. It is adaptive change. It is change to maintain stability. So it's a bit different than homeostasis, as you'll see. So allostatic load then, if allostasis is change to maintain stability, allostatic load is used to explain how the burden of external stressors hijack normal allostatic processes and become pathophysiologic processes. This is carrying a burden of stress, the weight of stress on you. And it's technically quite measurable based on the literature as well. So some of my students have seen this, but this is the actual slide that we use to show how that happens. So if you look at the top, that is the normal response. When you come down, what happens if you are that single mother and you're getting, normal responses every time you hear a gunshot in the neighborhood, every time you hear a helicopter flying over the neighborhood, every time you see the police pull up and run into a house, or every time the bill simply cannot be paid. Every time you have an argument with the father of your children who happens to be in prison or not in prison or whatever the case may be. Every time that happens, and this is for all of us, you have a normal response. If the hits are too repetitive, If they're too constant, then you stay in a state of fight or flight all the time. The human body's not made to be in a state of fight or flight all the time. It's not designed that way. And there's a lecture coming up May 11th here, why zebras don't get ulcers. I think you should see it because it'll speak to some of the reasons why, some of the same things, probably from a little different angle. Normal adaptation, you get like kind of a waning effect, but without it, you get a lack of adaptation, and you respond to the stressor as if it's the first time you see it every single time. You're gonna have prolonged response of people who just don't turn off their stress response. It just stays on. It just hyped all the time. And then there are people who just don't have a response at all. And this is Bruce McEwen's work again, as published. So when I was doing the research at Loma Linda on the Adventist Health Study and some of the other studies that they were doing, we were working on looking at the difference between white Seventh-day Adventists and black Seventh-day Adventists. We found some interesting things in that study. Although many of the stress indicators for black Seventh-day Adventists were greater than for white Adventists, if they lived the Seventh-day Adventist lifestyle, they actually were able to remove much of the health disparities. And we actually, there was one article actually published to that respect. We looked at what are proxy markers and true markers. I designed this myself, so don't write anything down. But we did this just for the study so that we'd have an idea of what we're looking at because we couldn't afford to draw blood on everyone. So we tried to set up a proxy marker. And I just put this up here to give you an idea of what we're looking at when you want to measure allostatic load. So diabetes mellitus we used as a proxy marker. If they were diabetic, it was a sign that they had increased allostatic load. And we graded these things so that we could just do a questionnaire and come up with a number on a scale without drawing blood. Then there was a group that we actually did draw blood on and then look to see how well it correlated. So hemoglobin A1C, that's actually spelled wrong, I think, from diabetics is one of the things that we looked at. And if you have a high hemoglobin A1C, it is a sign of high allostatic load. Systolic blood pressure, more specifically, cholesterol and triglyceride levels, BMI and waist-hip ratio, interleukin-6, we'll talk about in a second. CRP, C-reactive protein and fibrinogen levels. So if they had a history of MI, stroke, we assume that they would have high levels of this. Shortness of breath, asthma, we looked at, we would say if you have that history or history of shortness of breath, we said you had higher allostatic load, but ideally it would be actually be peak flow measured. That would give us that information. We look at catecholamines, thyroid function, higher cognitive function, and we did a memory test on some of them, run a smaller group, and it was very interesting because the minimum age was like 70 in the study. So it was interesting because we have these, the older Seventh-day Adventists who lived in Loma Linda all their lives, and they're able to just put their feet up and do this, and they drive to the meetings at 100 years old. It's kind of interesting, but it showed we were looking to see what markers were true, what weren't, and this is how you can actually quantify it. And I'll show you in a second. But the way that we do this is that we look at in an acute stressful situation, such as being chased by a dog. And I always tell a story, the students already heard, the ones in my class already heard the story, but we always top the fence to cut through neighborhoods. That was a shortcut, and it was a fast way to get where you're going. But every now and then you drop into the wrong backyard. And you see, it's interesting when I see people in Orange County walking around with their dog in a bag. That always cracks me up because when I was growing up, dogs had one singular purpose: security. They weren't pets, they weren't well fed, nobody bought special food for them. They lived in the yard and they were fed in the yard. They bathed in the yard if it rained. There wasn't a whole lot of love. But those dogs were angry. So they worked well for security. And so you land in the yard, and what would happen when you landed in their yard, and Brutus, I always say the dog's name was Brutus, picked up his head, is that all of a sudden, even if you're a 12-year-old boy like I was many times, adrenaline would be rushed out into your system, and all of a sudden your pupils would dilate, blood would be shunted away from your digestive organs, your pupils dilate, the blood flow to your muscles would increase, your heart rate increases, respiratory rate increases. You're ready to do one of two things: fight or fly. I don't say flight, you fly. You learn to walk on water if you have to. And this is how you respond. And that is a normal stress response. You should do that when you're faced with a challenge. This doesn't change if the challenge is that you go to work and there's an argument between you and a coworker. It's as if you ran into Brutus. This doesn't change if there's certain things that you're trying to do with the National Children's Study, just isn't working right. You're banging your head on the wall. Your body still releases adrenaline. Your blood pressure still goes up. Your pupils still dilate. If it's acutely stressful enough, you still respond this way. And remember, based on the graph, this is how you're supposed to respond. You're designed to respond this way so that in stressful situations, you can better respond to the stress. Why digest food when you need to be running? Your body can digest the food later. Time to run, so you run. And this is, typical of how we respond to stress and fight or flight, the way that we've been all taught that we do. The problem is, with chronic exposure to stress, poor social supports, and limited social networks, these have been shown to increase disease risk. So the Institute of Medicine actually put out this report that somehow, so there's two sides here. One, of course, are all those graphs and all that allostatic load. We also know there's some things that are protective, which is what we were really looking for in the Adventist Health Study. What about that lifestyle is so protective, even when people have higher allostatic load risks? So if you don't have certain things, you're kind of in trouble. So that single mother, if she has poor social support, if she is limited social networks, if she's high stress that she probably has, it's going to increase disease risk. Phillips looked at reaffirmed the connection between acute stress and acute respiratory infections due to decreased secretion of secretory immunoglobulin A. Again, your body shunts. Your immune system does not take priority if you're acutely stressed. And one of the ways that you know that, one of the proxies actually is, how often do you get the common cold? And when I was in college, we got a lot of colds.
I have a question going to that first comment right up there. I think it's very interesting, but is there evidence to show that, so say lower SES groups do have, like African Americans, blacks, have poor social supports for, say, out-of-wedlock babies and things like that? Because I think it could be argued that since there's so many, you have the chart, so many babies being born, that actually the support system is there, and it's sort of an accepted situation.
Two things are correct with what you just said. One, you can't assume African Americans are low socioeconomic.
No, but you were using blacks in
Yeah.
comparison. That's one of your.
Right, no, because a lot of people do that, and that's.
But you said you identified them as a.
Well, actually, that hasn't happened though. The idea, because that's different. Even if people accept it, it doesn't mean it's supported. When the baby needs changing in the middle of the night, it's not like you can call a neighbor and they're gonna come over and change the baby. Different than if you have a partner in the house with you. If the bills need to be paid, there's no pool of money somewhere sitting you can draw from to help pay the light bill. The social support networks just don't exist like that. The closest you might get is some faith-based organization or maybe some other community-based organization, but the kind of support that all of those women simultaneously need really doesn't exist. The closest we have in the United States is the government and government programs. But again, there's stigma that goes along with that. There are challenges. There are a lot of women who refuse to go and do it. They don't want the stigma of going and getting it, so they don't go and get it. And all of that, it's complicated. And obviously anybody who's raised children knows that first 2 years of life is enough of stress, or if you have to deal with the child by yourself, never mind dealing with them for the next 20-something years. And that's really what we're speaking to. There's unfortunately, I wish you were right, I wish it was communal living. It's not. Those mothers are left to deal with their child by themselves.
So there aren't statistics that there's multi-generational families in certain ethnic groups?
I don't know. There are multi-generational families, but
In the same house?
there's some research on that, but it's, even then, even if that's the situation, it's not ideal. These women they don't grow up and say, I want to grow up and be a single mother with 4 kids. I know I've worked with the population, that's not what they're saying. Instead, this is kind of what happens. And some of the bad choices, when people say, well, it's their choice, is because the default choices are often the worst choices as well. In other words, our society hasn't given them the best opportunity to make good choices. So we say those kids should have fruits and vegetables. In Santa Ana, I do talks on our availability of healthy foods right here in Santa Ana. The truth is that many kids come outside, and these poor Mexican-American families, they come outside and there's a truck that supplies them their food. They don't walk as far to the grocery store if there are gangs in the neighborhood. There's no real good way for them to get to healthy food all the time. There's no good way for them to get to exercise. So we come in and we say, with our health promotion, health education, have your child run more, he's getting too fat. Have your child eat more fruits and vegetables. Well, he's going to be running and ducking bullets at the same time. You see what I'm saying? Or running and seeing things he shouldn't see. So a mother who cares for the child would rather they stay inside and get fat than go outside and get shot at. And we assume that somehow, it's always the individual, but as a society, we have some responsibility to make sure every child has that same opportunity that the child in Irvine who goes outside and can run free has. So that is when we really start looking at it, it's a little more complicated, even in personal choice, genetics. It does get to a bigger, stronger connection. That's kind of what I'm trying to say. Stress has also been shown to potentiate the negative effects of a high-fat diet and initiate atherosclerotic plaque formation. Some of the early research on this actually came from World War II soldiers on autopsies done when 18, 19, 20, 21-year-old American men came back from the battlefield. They did autopsies and they found atherosclerotic plaques in them. A lot of people said, well, it's the American diet. What a lot of people now say is it's probably that combination of the American diet with the stress of going to war at an early age. And that's how fast it sped up the development of atherosclerotic plaques. So, adversity. This is Kanye West, who really made me upset when he stepped on stage. I wanted to jump to the TV and punch him. But his lyrics here are interesting. He's a lyric here, he says, they're gonna have to take, and this is speaking to adversity, we're gonna talk about adversity. They're gonna have to take my life before they take my drive, because when I was barely living, that's what kept me alive. Just the thought that maybe it could be better than where we were at this time. Make it out of this grind before I'm out of my mind. And he's speaking of the challenge. His mother was a single mother, trying to get out of poor neighborhood, difficult neighborhood, and he's saying, he's going to keep his drive before he goes out of his mind, because at some point you will collapse if you're bucking your head. If you go to school, the school system doesn't offer you much. When I lived in Miami to go to high school, we left Connecticut. I went to a suburban school system that was just phenomenal. There was no question that all the advanced placement classes I wanted, all the honors classes I wanted to take. We moved to Miami and we lived on the line where I could either go to the predominantly black school or the predominantly white school. They bused us from my neighborhood to the predominantly white school. And that school had every advanced placement class you could possibly think of, every honors class you could possibly think of. They had water polo, they had every sport you could possibly think of, sports I didn't even know existed at the time. And I was bused at that school and graduated in the top of my class, went on to have a good life. Had I gone to the predominantly black school, there may have had 2 advanced placement classes. The difference in what would have happened would have been very different based on where the line fell for me, myself and my family. My mother was a single mother of 3 boys, just kind of like the case study, except none of us luckily had any asthma. We had other problems, mental problems probably. But Kanye West has another lyric that that resonates with me as well. He has a lyric where he says, drug dealing just to get by, stack your money till it gets sky high. We weren't supposed to make it past 25, but the joke's on you, we're still alive. And if you grow up in these neighborhoods, a lot of times they think the honest opinion of the average young male in poor neighborhoods is they're not gonna live very long. So all of our health promotion, all of the things that we target them with doesn't work, because if I'm gonna be dead in 10 years anyway, what do I care what I do now? If I smoke, drink, take drugs, fight, gang bang, at least I'm living how I want to live today, because I don't see the hope of tomorrow. Very few people do I see live, black men do I see live long, get out of the neighborhood, not go to jail or prison, not wind up on drugs. It's dismal. In fact, the only real successful people that come out of the neighborhoods are athletes, entertainers, and drug dealers, if you want to call that success. I don't call that success. And so what happens? Well, you now have kids who model those 3 behaviors, right? And if you go into an inner city school and you say to an average young African American kid, what do you want to grow up and be? You're probably going to get one of those 3 answers. And it's unfortunate because they don't understand statistics. So they don't know that there's only going to be one Michael Jordan every 50 years. That of all the kids they play basketball with, probably not one of the ones that they know is actually ever going to make it to the NBA. They see the one who makes it, and it's like a dollar and a dream. It's like the lottery. You know what they say about the lottery, right? It's tax for people who don't know math. Because if you actually knew math, you'd never actually spend your dollar on it.
I thought it was really fascinating that you talked about the Seventh-day Adventists. Is it possible that what we're seeing with these disparities is something about coping mechanisms and beliefs, powerlessness or empowerment? And assuming that that's true, how do how would you improve health outcomes? It sounds like you have to improve somebody's health coping skills in order to address their asthma or maternal morbidity associated with preterm birth.
You're stealing my friend.
Okay.
But you're exactly right. It actually begins to speak to the new public health paradigm has to be broader than what we look at it as. And this is a very ugly dude, but this is Flav. I don't know how they made the show out of this guy. It's pretty embarrassing. But he has a lyric from one of the old Public Enemy songs, and he says, speaking about hostility, he says, "I got a right to be hostile, man. My people are being persecuted." And that sounds crazy all by itself, but if you feel like you are the bottom of society, the lower rung of the socioeconomic status, of the socioeconomic totem pole, and nothing is going right, you've been violated, victimized, whether you're Native American, whether you're Hispanic, whether you're black, whether you're poor white in Appalachia, it doesn't matter. The reality is, if you get this feeling, there's a hostility that will develop. This is the hostility that has Orange County jails full of Aryan skinhead gang members. This hostility that somehow our people have been treated unfairly. This is why the Indians, we talked about this in our last class when you showed a clip of a video, the Native Americans, that's one of the reasons they have such high diabetes rates. It parallels the high diabetes rates of other peoples around the world who have been disenfranchised, lost their land, the Aboriginal people of Australia, on and on and on. There's a pattern across the world, and hostility is one of the things that leads to health disparities. If you feel you've been treated unfairly as a people, never mind as an individual, you're going to carry a burden of stress that other people won't carry. So hostility and low perceived control, part of what Kanye West was talking about, are also related to poor health outcomes. Low perceived control is a determinant of heightened stress responses and poor adaptation. Adversity and vulnerability, along with psychological markers show such as low self-esteem and loneliness, are also associated with poor health outcomes. So you start looking at this and you can start to see that certain groups of people are going to be more susceptible to this than other groups of people. It's not genetic. It, in fact, goes along with societal norms, a lot of societal stereotypes, things that people assume about you before you open your mouth. And one of my good friends, she was a pretty blonde girl, and she said she hates going to the mechanic because the mechanic assumes, because she's a blonde female, she's dumb, and he can steal her money. And so she goes with her husband or she goes with her father every single time. And I said, I feel you. I know what it's like to go somewhere and people assume things about you and you feel like you're being taken advantage of. It isn't unique to any one group of people. We all have it, but all of it is a kind of stress that would that can over time change health outcomes. So depression and anxiety have been shown to increase the production of pro-inflammatory cytokines, including interleukin-6. This is one of the actual markers you can draw and look at allostatic load. High levels of interleukin-6 predict future disability in older adults, cardiovascular disease, arthritis, diabetes type 2, Alzheimer's, certain lymphoproliferative diseases or cancers. My mother died of multiple myeloma, non-Hodgkin's lymphoma, chronic lymphocytic leukemia. And I looked at this when I started looking at stress after my mother passed, and I started to realize how much of a weight of stress she carried since the day my father left her when I was 2 years of age. I can't imagine, now that I'm an adult, what in the world she went through when she was trying to make it. And she was very successful in life, but she was on the hospital board in Florida, and on the board there were Klansmen, known Klansmen in Homestead, Florida. I can't imagine what it must have been like to go into the meeting every time. And my mother was, she's a strong woman, but when it came to work, she was quiet. She didn't want to stir anything up, so she would have just gone and sat in the meetings and left, even though she would have been very uncomfortable. Interleukin-6 is key to promoting the production of C-reactive protein. C-reactive protein is now recognized as a risk factor for myocardial infarction. So we now know that there is truly, you can begin to connect the dots. The depression and anxiety that can come from stress literally can be quantified in interleukin-6, and we now know interleukin-6 connects to all of these diseases and the major #1 killer in the United States of America. We actually know how it happens now. And if you're from a group that is disproportionately anxious and depressed because of discrimination, real or perceived, because of environmental issues, real or perceived, you're someone who's going to be more prone to these outcomes. It starts to make a bit of sense. Another one to look at, elevated glycohemoglobin levels were observed with increased burden of adversity and vulnerability. Glycohemoglobin levels represent an impaired response to glucose tolerance before the diagnosis of diabetes. Glycohemoglobin, independent of other factors, has been shown to be predictive for cardiovascular as well as all-cause mortality. Again, you go straight to the real crux of what we're trying to prevent, early mortality. And we now know that you can draw the dotted line. And we know why you can draw it. We know what is going on that actually is correlated to elevated levels of glycohemoglobin. And this is something that is important if we're going to change the way we even look at how we practice medicine in the United States and how we do public health. Depression and anxiety have been shown to increase the production of, so to look at African Americans more specifically, they bear a disproportionate share of disease, mortality, disability, and injury. African American men live 6.2 years less than white men and 8.3 years less than the national average of 77.8 years. Martin Luther King, one of my favorite quotes, he says, "We must learn to live together as brothers or we'll perish together as fools." And so, you look here and it says reported death rates per 100,000 for people 35 to 54 years of age. Notice the youngest age there is 35. It's 2.3 times higher for African Americans than whites. That age is important because that does away with all of the homicide deaths. A lot of the HIV deaths in the black community all happen before 35. For white men, HIV deaths happen after 35. There's a difference when you look at the data. Adjusted for 6 risk factors, because everybody says, well, it's because blacks smoke more, have higher blood pressure, cholesterol, are fatter, drink more alcohol, or are diabetic. When you adjust for those, it goes from 2.3 to 1.9 times. If you adjust for income, everybody says ultimately this is about money, blacks are poorer. But when you adjust for income, it decreases to 1.4 times. That leaves about a third of the difference completely unexplained. Something else is actually going on. It's not what everybody thinks it is. And I'm trying not to mess this up like I did in class. I called Bernie Mac Steve Harvey. But that's Bernie Mac. That's Nate Dogg. Poverty control for leaves in excess of 38,000 deaths per year, or 1.1 million years of life lost among African Americans in the United States. Let me emphasize that this is not unique to African Americans. I use this because it's an easy way to show this. I can show this with Native Americans. I can show this with certain groups of Hispanics. I can show this with poor. If you compare poor whites in the South to whites in the North, there are a lot of ways that you can show this exact same thing.
And Hawaiian.
And Hawaiians, yes. You can show this with a lot of different groups, but this is one of the ones where the numbers are pretty big, so it's easy to show. And again, that was 35 to 54. If you go back further and look at infant mortality rates, so first you look at the 70% unmarried rate, but look at infant mortality rates. Here's the total, so here's the average. Here's non-Hispanic whites. Interesting, all of these groups actually do better than whites. That's Asian Americans, Cuban Americans, Central South Americans, Mexican Americans in infant mortality. When you come over here, look at the rates for non-Hispanic blacks, for American Indians, and for Puerto Ricans. Higher, especially for African Americans. Infant mortality is a lot higher. And again, a lot of the prenatal stress data is looking at that.
Would your graphs be any different if you were using socioeconomic status instead of ethnicity?
They would be different, but again, if you correct, as we did in that last slide, even when you correct for socioeconomic status, the differences remain.
The reason I'm raising it is that we know the blacks have moved into the middle class, or a small percentage of them, signifying that there is some capacity to correct this under capitalism.
Well, yeah, if capitalism to me could be part of the solution. It would be a great part of the solution if everybody starts off with the same footing. If everybody has the exact same opportunity and there's true competition, capitalism probably would help level the playing field well. But if certain people have advantages out the gate, capitalism is not very good at correcting the advantage that certain people get out the gate. That's the challenge you have with capitalism. And I'm into free markets. But I do believe, well, regulated free markets. But I do believe that unless you have fairness, I make the analogy all the time. What would the Olympics look like if every American girl had a chance to learn gymnastics? What if every single young girl, regardless of race, ethnicity, had a chance to learn gymnastics? Well, you would increase the pool of people you choose from, and all of the talents that go untapped would get tapped. The communist system What they did different is they make sure every single child is tested young, and in order to prove communism was better than our system, they try to get every child into the pool to pull from so that they could compete, and it worked for the Soviets. It worked well, and it works well for the Cubans.
It didn't work well for the girls. I mean, gymnastics is not the most healthy thing.
Oh, not again. What did I say? Basketball.
I wanted to say,
Golf.
there are some factors in social disparities that act in early childhood or
Yes.
and some factors that act throughout the lifespan. And, you know, people that move from poor neighborhoods to better neighborhoods, you know, move up in the social ranks, carry the risk that they gather.
We're going to get to that in a second.
Okay.
Because that's really the crux of this. How is it that you don't, even when you become wealthy, like Bernie Mac or Nate Dogg, how is it that you still die early, as both of them did? What is it that does that? How does that still happen? And the Australian government actually put these posters out. How many of you saw the movie Australia? I saw it in spurts as I woke up and fell back asleep. But I thought it was a brilliant movie, the parts I did see. And one of the things Australia is coming to grips with now is that many of the activists there argue that Tanzania is one of the few places in the world where you had actual genocide of an indigenous group of people. They talk about the fact that you could almost parallel what I'm saying about African Americans and Native Americans with the Aboriginal people of Australia. The state health department for Australia put out these posters and said, racism makes me sick. It affects my blood pressure and creates anxiety and depression. Racism makes me sick. It damages my heart, blood pressure, and my unborn baby. The state of Australia has gotten to a point where they're saying, look, these things actually harm the outcome for groups of people if we don't treat them right. Now, Australia had a white-only policy up into the 60s. Even if you were from the south of Europe and you weren't fair enough, you couldn't be allowed in to live in Australia. Into the 60s they had that policy. So they're dealing with that now, and I should commend Australia because this is a hard thing for the government to actually put out. So Carlson and Chamberlain, as well as Stanton, both present arguments for allostatic load as a framework to explain health disparities. Perceived race-based discrimination positively associated with raised and poor self-rated health. And I think one of the things that's important is the word perceived, because it doesn't have to be real. People just have to think it's real. And that's a problem because I always joke and say we probably should ban Al Sharpton from television for that reason. But the reality is, if people think they're being treated unfairly, it still creates an increase in allostatic load. And it goes back to what someone said about coping mechanism. If you can't learn to cope with it and you just internalize it, it's going to damage you. Perceived discrimination is the best predictor of smoking in 2 studies. Exposure to racial discrimination increases risk for preterm and low birth weight babies. Experience with discrimination associated with delays in seeking medical care. How do you answer it when people leave poor neighborhoods and become more wealthy? Oprah Winfrey is a billionaire with a B. I'm dying for my introduction to her because I would be a good capitalist if I ever had some of her money. But Oprah Winfrey had an experience where she went to a boutique in Paris and wasn't allowed in late, and she perceived, I don't know that this is actually what happened, she perceived that it was because she was black and probably not dressed up, and they probably couldn't recognize her, even though I don't know if they watch Oprah Winfrey in Paris. And so she wasn't allowed in, and she made a stink of it and thought it was because she was black. The owner of the boutique has boutiques in all of the key cities in the world, New York, London, wherever, came on her show and apologized extensively and probably said, whenever you come to the store, I'll open it for you personally because I don't want this bad press. But I think about it, with all of her billions, she's still a victim of the perception that she was treated unfairly based on her race. That means all of the allostatic load things that I've mentioned before, she couldn't even protect, the billions couldn't protect her from the response. The money can't protect you from the response if that's what you feel is happening. That stress level then doesn't go away.
But there's a similar finding about social class, that perceived social status, subjective social status predicts more disparities than objective social status.
Very true. Very true. And so that's one of the things, and so this is one of the things that I think, and I don't think the solution is necessarily simply, as Australians are going to say, we'll stop racism. I think part of it also is for African Americans to work with African Americans to cope better and to actually realize it's not always racism. It's sometimes the person just isn't nice. and you go in there and you assume it's because you're black. But it may not be. It may just be that it's a bad person. It didn't matter who of us walked in there. So you got to learn to actually turn the other cheek, to look the other way, to go to, you know, a deeper, stronger way to respond to the society. Because being angry, hostile, pent up, as Martin Luther King described in the Civil Rights Movement, does you no good. If you hate your brother goes on and lives his life and doesn't know. All of the hatred actually ends up destroying you. All of the anger ends up destroying you. So you can't live angry at the world, especially if the world doesn't even know you're angry, because it will destroy you. And this is one of the messages, I think, for all of the different groups of people, and now white males to some extent, you know, black men, I mean, all Americans, everyone fighting for that piece of the pie, believes that they're the ones getting the short end of the stick.
But is it just anger? Wasn't there a study that had young black children and some white dolls and
Yes.
black dolls, and the children perceived the white dolls as smarter and
Prettier, more valuable.
And yeah.
And that study was
I
done.
saw that. A girl like me, I think, is the film.
Yes. That was redone. That was originally done back in the 50s. And it was shocking, and it made sense in the 50s. Everybody would say, well, if you look at television, if you look at billboards, it would make sense if you think that way. Nobody thought you'd get the same exact results in the 2000s. But you do, and so you're right. It goes beyond this being kind of a more palpable way to see it. But the fact of the matter is our society presents images and realities that make you think you're inferior, that makes you internalize hatred of yourself. And that internalizing is also something that will set off allostatic load.
The reason I'm raising socioeconomic status is that the history of this country with the terrible prejudices against blacks, people of color, led in the 40s and 50s to black power, and white supremacists and those in power perceived this effort on the part of the blacks as threatening their status. Whereas if we emphasize socioeconomic status, the turn to the labor movement as a means of correcting this terrible injustice that has existed in our society.
I agree with you. I actually think it is about time, with certain exclusions, America moved beyond race. Because the fact of the matter is, my work in Alabama, when I was a family medicine resident in Alabama, and I used to moonlight down in a town called Wadowee. Now, the principal of the school there shut down the prom because a white young man was going to bring a half black, half white girl to the prom. He canceled the prom. The Klan marched, and of course, me not knowing, trying to make extra bucks, I was driving into the hospital to work. But what I found in those situations is poverty doesn't know color. Poverty is real. There are twice, when Martin Luther King wrote his last book in '67, one of the things he said is that he will move beyond dealing with poverty as it has been produced because of race and discrimination. Instead, he said, we will deal with poverty because poverty, there are twice as many poor white Americans as there are black Americans. So Martin Luther King said, we're no longer, and this is when he became incredibly unpopular in the North. See, the Northerners were happy when he was dealing with Jim Crowism in the South. They didn't have Jim Crowism. Once he started dealing with labor movements and fair pay and poverty, regardless of what you look like, and the Vietnam War, of course, he became much less popular in the North among even liberals. And you're right. It's right on the mark. Again, if we correct opportunity and make sure that everyone has more fair opportunity, and we do certain things to protect the most vulnerable aspects of our society, some of it can correct on its own. We've seen that in other parts of the world. But it's important in America that we recognize why we got where we got, but we do need at some point to move on. And I think labor and again, fairness, social justice, as it pertains to all these different groups of people, is the solution. Because again, there are groups that are being left behind inside the current. There are many white Americans that need to be socially supported just as much as black Americans. I mean, that's just the reality, especially if you go down south, you go to certain parts of California even. I went to parts of Alabama where there were trailer parks without electricity and running water. And the inhabitants were all white. And I've never seen anything like that in any of the ghettos of the North. So it's bigger than race, clearly. Race is probably one of the best ways to show the example. But again, America's going to have to move beyond that to social justice and fairness for all of our citizens.
In these international studies that compare different countries, what they show, as far as I know, is that the more equal a society is. I mean, the less of the range of social differences, the shallower this gradient. But one of the fascinating things about the social gradients of health is that it's not just a difference between the rich and the very poor, it's something that acts at every step of the social ladder. So even when you're relatively well-to-do, or in Britain, you know, the Whitehall studies where they compare civil servants in the British government, you have a good job, you earn your income, you have a national health service, but still your health is not as good as the one that is one step above you in the hierarchy.
Yeah, that's,
You know,
I did that talk for the students 2 weeks ago, that you can look at, when you look at the social determinants of health, one of them is where you fall even on the socioeconomic, well, not on the pecking order inside the organization where you work. How many Oscar awards an actress or actor wins will determine if they live longer than the actors and actresses that don't win them. There are a lot of different ways that that this plays out. But the bottom line being, I think going back to is to go back to fairness and all of those different things. And you're right, it isn't this simple. I mean, this is one good example, but it really shows that as a society, you have to speak to deeper, harsher issues. And when you get beyond this one, you're right, there'll be other obstacles, other ways to find ways to try and make things better as well. Let me get through the last 2 slides, because we have about a minute left. So public health implications. Hopefully when we start looking at allostatic load as a cause and stress as a cause of health disparities, we'll look at a more defined way to deal with it. It may change certain policies as stronger connections are made. Hopefully shift the focus in medicine to be more preventive in nature, focusing on environment and relational issues facing patients. Strengthen the role of different intervention models such as group visits, social support systems inside medical treatment, and we know that that works with drug addiction to some extent. We don't use it as much for diabetics. We don't use it as much for obesity treatment. So it may be that we can do this to gain social support and social networking since those things seem to work. Some of the future research stuff that can be done, search for treatments that block the release of the mediators or diminish their effects. I hope this isn't the only way we do that, but this is something that I'm sure at some point, as these things get stronger, pharmaceutical companies will look at, if they're not already. How does lifestyle changes affect marker levels and affects? Maybe I didn't finish that, but lifestyle we know can be protective. That's one of the big things. What you eat, how much water you drink, how much sleep you get, all can be protective. In the Adventist health study, we found that black Adventists slept on average 2 hours less than white Adventists. And that is in a study where the black women in the study actually made more money than white women in the study. It was, it's an interesting, different group of our segment of our American population. And sleep is strongly a predictor of how healthy you're going to be. So, what lifestyle changes need to be? How does social support and faith participation affect marker levels and functions? And how does peer pressure and medial stereotypes affect allostatic load? That goes back to the idea of the dolls and those different types of things. That's the last slide. So we probably don't have any time for questions, but we did sprinkle them inside the talk. I thank you for coming. I appreciate your comments and questions. As we keep looking at this, hopefully we keep making progress in the research and in the literature so that we can actually come up with different practice models for medicine and public health.
Many thanks for the provocative lecture. There may be time for 1 or 2 more follow-up questions, but yeah, Kanye.
I have a question about which you think comes first or second now that you've been studying the allostatic load. Because a lot of the same indicators that you're using are also shown in environmental health issues. So are you saying that the stress and the fight or the flight creates a precondition for environmental factors to be reactive, or which one comes first?
I can't say I have the definitive answer on that, but I would say this. I think that once that stress pathway is turned on and allostatic load is increased, you turn down the immune system, you increase inflammatory reactions in the body. So by default, anything you come in contact with that that would be a pollutant, a toxin, is probably going to have much more of an effect on you than it wouldn't have. And there are studies that show that.
Right.
That literally, how you respond to environmental, toxins, allergens, whatever, can be dampened or exacerbated by what your stress response or stress level already is. So I can't say that one starts or the other one starts, but I do in my gut think that stress, as a toxic stress, really is probably what triggers much of it. And the more stable environment for children especially, the more wholesome the environment for children, the better long-term health outcomes that child's gonna have. Because these patterns then begin to develop from childhood, and they begin to affect disease years and years and years and years later.
I do research on socioeconomic disparities in health and cancer outcomes. But I want to come back to your point about the impact of perceived racism on health. I think it's a very real thing, and I think it's really important that we look at both of those issues together and separate. And I was wondering if you knew anything about some of the implicit association test studies that have shown that that racism isn't always something that we consciously perceive. Right. There's some really good work out of Harvard. Nancy Krieger's group has done a lot with showing that racism is very much still around, and it's just not something that we always consciously perceive, but there's some interesting effects. And it's not just racism. There's lots of isms.
Gender,
right?
there's
gender,
there's class,
body weight discrimination, ability discrimination, and that group does a lot of that kind of good work.
I've done research on long hours and sleep deprivations and cardiovascular health, and that is very related, associated with the concept you talked about, the static load. And I wonder, when you do research or you do research do you see kind of trend that you have to have a group of indicators, or just pick up a few,
I think it's a group of indicators.
You have to kind of look at them.
Yeah, and lump them together.
Lump them together.
Because that's what happened in the health study, that was important. They had a whole collection of them, and they looked at the kind of the gestalt of them. And
So you can't just say hypertension.
Right, they didn't just say one thing. And in fact, I think one of the weaknesses of research in the United States is that we always try to find the one thing. That one aspect, that one factor, that one thing, and it's so much more complicated than that. That's why I'm such a big proponent of National Children's Day. Because I think until you do the research where you actually look at everything all together kind of at once, a lot of the answers just won't become clear, because we're going to ping pong back and forth between what's the problem if you're only looking at one syllable. We're only looking at systolic blood pressure, cholesterol, how much meat they eat, how much dairy they eat. We're always looking at one thing, whether or not they eat, no goji juice or berries or whatever. We're always looking at this one thing as a magic bullet to solve the solution. It's so much more complicated than that. And that's why stress makes sense, but it doesn't, even all by itself, that is mediated by certain things or exacerbated by certain things. So I think lumping things together made a strong, in the Adventist Health Study, made a much stronger statement of who really was stressed and how much things actually helped or hurt the stress levels and then disease outcomes.
Thank you.